Let's now talk to Health Undersecretary Myrna Cabotaje. She's also the chair of the National Vaccination Operations Center. Good morning, Yusek. Thank you so much for joining us. Now let's talk about the 2 million expiring COVID vaccines next month. How are you planning to increase the vaccination rate, especially in remote communities?
We have conducted micro-planning sessions. These are special planning sessions with our local health workers in areas which have very low coverages to take a closer look at more micro level, no? Even at the level of the barangay, what to prioritize, how to do it, share with each other the experiences, and hopefully we can ramp up our vaccination rates. The Civil Service Commission, through the chair, Carlo Nograles, has also issued an advisory, a reminder for all our government employees to have their booster shots taken. For those who are already due for their booster shots, and for the first and second doses for those who have not yet taken them.
Ma'am, what regions will you be focusing on? What are the areas that have a low vaccination rate?
Region 12, not any one of their provinces have reached the alert level 1. They have not de-escalated because they have not met their vaccination coverage, fully vaxxed and senior citizen. BARM, we have already focused on them. They had a special vaccination days last May 11 to 20. Our region 9 is on the way. We are doing areas in Negros, both Oriental and Occidental today, including Quezon province, because that's the only province in 4A that is not yet at par in terms of its vaccination rates. And we have done Palawan and Masbate also.
The government's target, ma'am, is to have 77 million fully vaccinated individuals by the end of June. Could you give us a status update on this? Where are we?
Yes, the 77 million target by end of June is 70% of the population. We are at 69.1 million, so a hard push. We hope that we can have first doses by the end of June 5. Otherwise, it will be with very great difficulty that we will be able to reach the 77 million. At least close enough will be good for us.
Right, and there's only really a few more days to do that. And the big concern here, of course, is the emergence of new Omicron subvariants. In light of this, ma'am, how important is it to get that second booster shot, especially for the most vulnerable, who are, of course, the frontliners, seniors, and immunocompromised?
The priority for these groups are because they are at risk. They are the ones exposed to the cases. The vulnerable groups have very poor or weaker production of antibodies. No, matamlay yung kanilang paggawa ng kanilang panlaban. So we need more protection, and we can do that by giving them the second booster, so that their immunity will become longer and it will be stronger.
Ma'am, onto a different topic, monkeypox. Now, monkeypox has not yet been detected here in the Philippines, but if ever it does reach the country, how ready are we for this? Do we have a vaccine supply, or will the old smallpox vaccines do?
Yes, in terms of the vaccination, the department is looking into the possibility of utilizing the smallpox vaccine, but it will be the same strategy for COVID-19, our further policy, especially controlling the borders, seeing to it that we screen those who have monkeypox, and we do genome sequencing to determine whether the virus has entered the country. And the health facilities are ready with their infection control. As in any communicable disease, the same procedures, the same precautions. Of course, the medicine and the treatment will be different, but the general precautions, the general treatment will be the same.
All right. But in terms of a vaccine supply for this, ma'am, do we have enough?
Uh, as of the moment, there is apparently no need because it has not has not yet really spread in the country, and but the DOH is coordinating with the manufacturers of a smallpox vaccine, because there is no current available vaccine for monkeypox, so they're using the smallpox vaccine, and we are trying to see what are the manufacturers that can give us the smallpox vaccine, because we all know the smallpox vaccine has also been smallpox has been eradicated, so the vaccine is not readily available.
All right, ma'am. Thank you so much for your time this morning. That was Health Undersecretary Myrna Cabotaje.